Hi everybody, welcome back to another episode of DxTx. I'm your host Sahan and Safi, and this week we're going to be talking about COVID-19. In the last few months, we've seen the coronavirus take the world by storm. It's essentially swept across the globe. It's affected almost every single country on the planet, and it's gotten a lot of media attention. In today's episode, I'm not going to hammer home the signs and symptoms of coronavirus because I expect that you guys are all very familiar with that. But I want to talk about when should you seek care in Canada with regards to the coronavirus, when should you be staying at home, and talking a little bit more about what you can do to prevent yourself from getting the coronavirus and to help us in managing this pandemic. From an emergency department standpoint, the first thing that I want to talk to you guys about is when do you need to seek care? Over the last few weeks, I've been on shift and there seems to be two subsets of patients that we're seeing. The first subset are patients who come to the emergency department because they've traveled or they've been exposed to someone that might have had coronavirus who are asymptomatic. If you are asymptomatic, but maybe were exposed or are concerned that you were exposed, at this time, there is no role for you to leave your house. As you know, we keep talking about social distancing measures. We will not be testing you based on our current guidelines for coronavirus. The reason for this is that with minimal symptoms or no symptoms, the chances of the test coming back positive are quite low. And this ultimately is not going to change what we do. A lot of people are listening to the media and are scared about the fact that they could have coronavirus. What you need to understand is that that does not change what we do in terms of your management. The people who we worry the most about are those that have multiple medical conditions, those who are elderly, and once they get sick, they tend to get very sick. And we get worried about those individuals who are very sick because they may need life-supporting medications as well as interventions that can help them breathe when they cannot breathe on their own. If you have minimal symptoms or if you've been exposed and have no symptoms, there is no role for you to come to an emergency department or a healthcare provider if you feel well, because there's nothing that we would do. Even on the odd chance that you have the coronavirus, if you have it, all we're going to tell you to do is to self-isolate, to reduce the people that you're exposing the virus to quarantine yourself at home, practice good hand hygiene, and to wait until your symptoms get better. If you are having significant symptoms and you're concerned about coronavirus, that is when you need to seek care. What are significant symptoms? The more serious symptoms that we worry about are people who present with shortness of breath, lethargy, so you're drowsy, you're confused, you're sleepy, you're not acting like yourself. You know, if your elderly grandparent has been coughing and had a fever and now they're behaving abnormally, or they're exhibiting extreme shortness of breath, they're complaining of chest pains, those are the symptoms that we worry about. So are you experiencing a flu-like illness with symptoms of shortness of breath, chest pain, confusion, lethargy, drowsiness, things that are much more severe than what you would experience with a normal flu? If you're experiencing symptoms like that, you absolutely need to seek care from a healthcare provider. In those situations, our guidelines recommend testing these individuals, and if we determine that you require hospitalization, we will hospitalize you and provide you with supportive care. But if you're worried that you were exposed to the coronavirus or that you might have them with mild symptoms, by not staying at home, all you're doing is exposing other people in the community, exposing healthcare providers that are trying to care for the sick to the virus unnecessarily. So really, you want to stay at home as much as possible. This takes me to the next point, which talks about social distancing. So what is social distancing? What is physical distancing? A lot of media attention now on physical distancing. And really the idea behind this is very simple. Our healthcare system can only deal with so many sick patients at a time. And what we're trying to do is reduce the amount of transmission of this virus within the community as much as possible. So what we've done is we've implemented drastic measures that we've really never seen before by shutting down non-essential services. You can no longer go to bars, restaurants, public spaces where groups of people can gather, that increase the chance of people transmitting this virus to one another. The biggest thing with social distancing is it does not work unless everybody is on board. So it doesn't mean that if you're asymptomatic, you can leave your house and go outside and do everything that you want to do. Really, you want to minimize the number of interactions that you have with people with whom you do not live. So even if you're well, that every time you go outside and you walk by somebody or touch something or sit on something that somebody else may have touched or sat on, you're increasing the chances of this virus being transmitted to you or from you to another person. So you really want to do your best to stay at home and avoid contacts with others as much as possible. Does this mean you have to lock yourself in your house at all times? No. But what it also means is that you shouldn't be going to a park with a large group of friends, with family, where all of your kids are playing in the playground with one another, or you're at a dog park and your dog's running around and you're talking to other people at the dog park next to you. That also doesn't work. So really, if you do go outside, you need to get a breath of fresh air. It's best to do it at a time that's not busy and at a time that you can ensure that at all times you're maintaining a 2-meter distance between you and the other people around you. It doesn't work if you're constantly brushing up and rubbing against people within that vicinity, because again, it defeats the purpose of that physical distance that you need to establish between the people around you so that the virus is no longer transmitted. In addition to social distancing, the next best thing that we can do to help prevent the spread of this virus is good hand hygiene. And I'm sure you've heard about this all the time, but 15 to 20 seconds of hand washing regularly, avoiding touching your face, that can all go a very, very long way in preventing the spread of this virus, as well as in combination with the social distancing measures that we've all been taking. The last thing that I'm going to say is that I know this is an extremely difficult and stressful time for everybody who's watching this video, but I encourage you to continue to do everything that you can to optimize your social distancing, physical distancing, and hand hygiene to help us get through this together. I'm very proud to be Canadian, and I'm very, very proud to see all of the things that people are doing to help prevent the spread of this virus. And I'm confident that if we can continue to work together as a nation, we will be very, very proud in a few months. So do your part, wash your hands, social distance, and I hope that you can stay away from the emergency department in the next few months. If not, we'll be there to look after you.